Okay, so I'm going to be discussing the Sir Richard Dahl discussion questions and talking about smoking and epidemiology. So to start out with breaking down the smoking rates in Arkansas compared to the national rates, as well as like the demographics of smokers, I found a smoking and tobacco data deck from the Arkansas Department of Health that has a lot of really good information about this. And it shows the rates in Arkansas versus the US for smoking. And it puts, in the year 2020, it puts Arkansas at 20.5% of the adult population, so above 18 in Arkansas, 20.5% are smokers. And this is higher than the US national average of 15.5%. So Arkansas sits above the national average in like percentage of smokers. And then when you break that down across gender, 22.2% of males in Arkansas smoke and 18.8% of females in Arkansas smoke. We don't have a category for non-binary or other, but we do see those male and female breakouts. And then when you look at age demographic in Arkansas, the age group 30 to 44, has the highest percentage of smokers, 30.4% of adults age 35 to 44, 30.4% smoke in that category. And the second highest is the category directly after that, 45 to 54. 26.6% of adults that age smoke. And it also breaks it down by race and ethnicity. So it's broken down into white and black adults. So Arkansans above age 18, 21.3% of white adults in Arkansas smoke, and 19.0% of black adults in Arkansas smoke. Okay, yes. And then as far as the burden of cigarette smoking, the CDC says that in the US, cigarette smoking kills more than 480,000 Americans each year. And from a financial standpoint, cigarette smoking cost the United States more than $600 billion in 2018. And that includes $240 billion in healthcare spending. And then it also includes costs for lost productivity. In 2021, so a year after the Arkansas data deck was collected, the CDC estimated that 11.5% of US adults currently smoke cigarettes. So we see that smoking rates in Arkansas are higher than the US national average. And from an epidemiologic perspective, I think there's a few comments on those results. So we saw that the averages in Arkansas were higher. And I think that a lot of our socioeconomic status in the state plays into our smoking rates, as well as stress levels and lack of mental health interventions, which I'll talk more about, I guess, in the third part of the discussion forum. But I think that from an epidemiologic perspective, we have a higher prevalence of smoking among our population. And we have a smaller population than many states. But yeah, and I guess hitting on question number 3, it's talking about like why do cigarette smoking and tobacco related products remain a leading cause, morbidity, mortality, and disability in the US and globally, even after evidence that smoking causes lung cancer? Well, I think there's a couple reasons that play into this. One, tobacco and nicotine is addictive. So obviously there's going to be a barrier to quitting, because once you are addicted to that substance, it's been proven that it's hard to quit something that you're chemically addicted to. So obviously that plays a role. And I do think that the high levels of stress and mental health problems within specifically our state population, but even nationwide when compared to other nations, just around the world, the stress levels are very high. And I thought it was really interesting in the video about Sir Richard Dahl, how he did the case control study among physicians. And I thought it was so interesting how that was the like the target population for the study, because a good amount of them smoked cigarettes. And I just think that that also clues us into stress as a factor in the tobacco crisis, because physicians are consistently under, a large amount of stress, and they're working long hours. They have short breaks. It even said in the video, like, their breaks are often just long enough to smoke a cigarette and not much longer than that. And so I think for that population, but even for population of people around our state, the more mental health interventions we have and the more things that we can do to lower stress, I would be interested to see studies done on if that plays a role, or if that's associated with lower levels of smoking, because I would hypothesize that it would be. I think that cigarette smoking is most closely comparable with the combination C for like the type of cause, not necessary but sufficient. Because when you're thinking about lung cancer, people can develop lung cancer who are non-smokers. They don't necessarily have to be a smoker in order to develop lung cancer. But I do believe, and I actually am a data analyst, I'm not a clinical like nurse or doctor or anything, so I'm not sure if I'm the best person to speak to this, but I would think that cigarette smoking on its own would be sufficient enough to cause lung cancer, and I think that's what we're learning here. So it's not necessary, but it is sufficient enough to cause our outcome. And lastly, talking about like, oh, if we just knew what caused something, then we could completely eliminate that disease. Like, and the question's asking like, what are some similar public health issues to, tobacco industry? And I kind of thought of the public health issue of drunk driving, or even like practicing seatbelt safety when driving. We know that driving under the influence of alcohol puts you at a substantially higher risk for getting in an accident, a trauma accident that may cause harm to you or to other people. Yet that's still a large problem. I still see signs everywhere, and I know that the numbers tell us that there's a large proportion of people who, one, drive drunk, and then you can even expand that to like texting and driving. And I think that that also has to do with, one, addiction to substances, but two, just like our inability to think long term, or at least like in that moment, inability to think long term, and a desire to make a decision that's going to benefit us in the short term without thinking about the ramifications in the future. And I think that that's a lot harder to combat than just saying, oh, if you drive drunk or if you text and drive, you're more likely to get in an accident, because it doesn't feel personal. It's like the bystander effect in psychology a little bit. Like, people may think, yes, I know that's bad, but it might not happen to me. It's not a real threat. So that was just something that I thought was similar. And also, side note, I thought that the video was hilarious. The country song about the Big Tobacco saying sorry. That was very funny, and I think that's going to be stuck in my head. Thank you.